Epidemiology. Epidemiology is the branch of medical science that studies the distribution, frequency, and determinants of health and disease in human populations. It aims to identify the patterns and causes of diseases, and to develop and evaluate interventions to prevent and control them. The father of epidemiology is widely regarded to be John Snow, 1813 to 1858, a British physician who is famous for his work on the 1854 cholera outbreak in London. Snow's investigation into the outbreak involved creating a map of the area affected and using this map to identify a contaminated water pump as the source of the outbreak. This work was instrumental in demonstrating the importance of epidemiological methods in investigating disease outbreaks and in developing public health policies and practices. Snow's work also contributed to the development of the germ theory of disease and to the establishment of modern epidemiology as a scientific discipline. He is considered a pioneer in the use of statistical methods in epidemiology and is often cited as an early example of a data-driven physician. Epidemiologists use a variety of methods and tools to study the occurrence and distribution of disease. These include descriptive epidemiology. This involves the study of the distribution of disease in a population, including its incidence, the number of new cases of a disease in a given time period, and prevalence, the total number of cases in a population at a given time. Descriptive epidemiology can help identify trends and patterns of disease, as well as risk factors and populations at higher risk. Analytical epidemiology. This involves the study of the determinants of disease, including risk factors, causes, and mechanisms. Analytical epidemiology can help identify the factors that contribute to the development of a disease, as well as potential interventions to prevent or treat it. Experimental epidemiology. This involves the use of randomized controlled trials, RCTs, to evaluate the effectiveness of interventions in preventing or treating disease. RCTs are considered the gold standard in clinical research because they allow for the rigorous evaluation of cause and effect relationships. Epidemiologists also use a range of statistical methods to analyze data and test hypotheses. These include measures of disease frequency. These include incidence, prevalence, and mortality rates, which provide information about the occurrence of a disease in a population. Measures of association. These include relative risk, odds ratio, and attributable risk, which can help identify the strength of the relationship between a risk factor and a disease. Statistical inference. This involves the use of hypothesis testing and confidence intervals to determine whether an observed association between a risk factor and a disease is statistically significant. The 5 principles of epidemiology are: distribution. Epidemiology examines the distribution of a particular disease or health outcome within a population. This involves analyzing the frequency, pattern, and geographic distribution of the disease. Time. Epidemiology considers the time trends and patterns of a disease, including seasonal variation, secular trends, and cyclic patterns. Place. Epidemiology examines the geographic distribution of a disease, including the regional, national, and global distribution of a disease. This helps identify risk factors associated with certain geographic locations. Person. Epidemiology considers individual characteristics such as age, sex, socioeconomic status, and lifestyle factors that may affect the likelihood of developing a disease. Cause and effect. Epidemiology aims to determine the cause of a disease or health outcome, including identifying risk factors and determining whether an association between a risk factor and a disease is causal. It also considers the effectiveness of interventions aimed at preventing or treating the disease. By considering these 5 principles, epidemiologists can identify patterns and causes of diseases, develop and evaluate interventions to prevent and control them, and inform public health policies and practice. The main concepts of epidemiology are: disease occurrence. Epidemiology examines the frequency and distribution of diseases in populations, including incidence, the number of new cases of a disease in a population over a certain period of time, and prevalence, the total number of cases in a population at a certain point in time. Determinants of disease. Epidemiology examines the risk factors and causes of diseases, including genetic, environmental, and behavioral factors. It also considers the interactions between these factors and how they contribute to the development of diseases. Public health surveillance. Epidemiology is concerned with monitoring and reporting disease occurrence and outbreaks, and tracking changes in disease patterns over time. Intervention and prevention. Epidemiology aims to develop and evaluate interventions and prevention strategies to control the spread of diseases and improve public health. Study design and analysis. Epidemiology utilizes various study designs and statistical methods to investigate the occurrence and determinants of diseases in populations. By understanding these concepts, epidemiologists can identify patterns and causes of diseases, develop and evaluate interventions to prevent and control them, and inform public health policies and practice. Epidemiology is used in a variety of settings, including public health, clinical medicine, and research. It is used to identify and monitor disease outbreaks, to evaluate the effectiveness of public health interventions, and to inform clinical practice and healthcare policy.